Hi, I'm Rian Maelzer in the central business district of Malaysia's capital, Kuala Lumpur, the usually bustling central business district, but today Malaysia is under lockdown. It's been under lockdown for a week. There are some vehicles behind me, but that's because there's a police and army roadblock just in this direction that we'll visit in a short while, and they're stopping cars, so there's a bit of a bottleneck there, but the lockdown seems to be having the desired effect, with police saying that about 95% of people are complying with this lockdown. I'm just going to go to my phone now, see if I can find this live stream on Facebook so that I can look for questions of yours as they come in and comments. And there we are, Malaysia under lockdown. And there I am, live on TV. Okay, now the lockdown has been in place for a week. It happened after we saw a spike in the number of local coronavirus cases. Now, basically, to give you a bit of a chronology, there have been two waves. The first wave were infections that were imported from China effectively. Visitors from China, Malaysians returning from China, people having contact with those people that had visited China. But the number of cases was tiny. There were only about 22 infections, and we went a period of some 11 days with no new infections, and I suppose there was a false hope that the worst was over. But then we started to see the local transmission and contagion of this disease and the pandemic, and then we saw a sharp rise. And after that sharp spike, the government announced it would put in place what is called officially a movement control order. I note that other countries that have less stringent measures than Malaysia are calling it a lockdown, so we will, for the sake of shorthand, call it a lockdown as well. It's a partial lockdown, really. Essential services are still open, restaurants are open for takeaway and delivery, supermarkets, pharmacies, but all colleges and universities are closed, all public meetings and gatherings are banned, as well all religious places of worship, including mosques in this very Muslim country, are closed as well. And all Malaysians are banned from traveling overseas, and all foreigners are banned from coming into the country. But one issue that we had was the spike in cases. 60% of the current cases are linked to a single event. And I'll tell you a bit more about that later. But because we saw this spike in cases, the government decided that it had to take firmer action, and it's brought in the army to assist police. Basically what we saw was, in the first few days of this lockdown, at least the first couple of days, people just weren't taking it seriously enough. They were going out for trivial reasons, saying one person told the police that, oh, I'm going because that restaurant has delicious food, or they were going because the vegetables were fresher in that area. And noisy motorbikes are still a problem here, even when there's a lockdown. As well, as soon as the Prime Minister announced the lockdown, then people made a mad dash back to their hometowns. We call it balik kampung, returning to the home village, basically. And this was clearly not the intention that the government had when it instituted this order. It wanted people to stay put, but it wasn't clear enough in its message. So people took it as if it was a festive season, and they jumped in their cars and they headed back to their hometowns, where there'll be a lot of old, vulnerable people, and it was really not what the government had intended. So the next day, the Prime Minister went on TV and made a very impassioned, heartfelt speech to the people, and he told people, he implored people, just stay at home. We want to get on top of this virus. You have to just stay at home. And now police say that there's about 95% compliance, and they're mounting these roadblocks. As I say, I'll take you over to see one of the roadblocks in a minute. Now this area, this is the central business district. We call this the Golden Triangle, and this is normally absolutely bumper to bumper with traffic and hordes of people walking on the streets, locals going to the offices and shops. There's shopping malls here, and you know, there's a MRT station just over there across the street. This will be loads of tourists here as well. Just on this side, if we turn this way, you'll see this is a monorail station. Now the monorail and the other public transport is working, but in a very limited way, only a certain number of hours a day, and very, very few people are using it. Only those people that need to get to work for essential services. As well, you can see the police roadblock over here, and they've mounted large number of roadblocks, and this is the police and the army are both collaborating here. And what happened was, when the Prime Minister deemed that people were just not taking this seriously enough, he called in the army to help. It's not like a curfew, it's not martial law, anything like that, but it's just to beef up the numbers so they can hold more roadblocks, and also seeing the men and women in camouflage outfits and with their large guns, I think is acting as a deterrent. It's getting the message home to Malaysians that this is very serious. They have to take this seriously. And we can take a stroll over there in a minute, but I wanted to tell you about the incident that really has boosted Malaysia's numbers significantly. It's responsible for 60% of the cases, much as in South Korea we saw that one church group was responsible for a majority of the cases. And it turns out that at the end of March, there was a huge gathering of some 12 to 16,000 Muslim missionaries at a mosque in Kuala Lumpur. And the first that we heard of any cases coming out of that mosque was when one of the participants returned to Brunei, neighboring country of Brunei, and tested positive there. And Malaysian authorities were alerted. They started to ask people to come in and be tested, and then the numbers just spiked. But unfortunately, a lot of the people that took part in that event were very slow to come forward. So now 60% of the cases Malaysia has, about 1,600 cases in total, are linked to that one single event, and it's rising every day still. And there have been 15 deaths, and about the same proportion, at least 60% of those deaths are also linked to that same one event. But it seems like those numbers are dropping a little bit. The day before yesterday, the number of new cases was around 200, and yesterday it dropped to 100, but we're being warned that we're not seeing the impact of this lockdown yet, and those numbers could still rise again. So I can have a look, quick look, see if there's any questions coming through, any comments coming through. Well, I see a lot of likes. I'm not seeing the comments, but that might be my inability to know how to use Facebook, I'm afraid. Well, I know how to use Facebook, but the Facebook live stream. Okay, give me a second here. Anyway, we can take a stroll down to the roadblock. With luck, the police will give us some leeway because as media, we're considered an essential service. So bear with us. We'll take a stroll over there to the roadblock. And police at this stage, they're not arresting people for the most part. There have been a few arrests for people that really have not been cooperating. But for the most part, they're just advising people, giving them friendly advice, warning them, chiding them if they've got too many people in the car, if they're traveling for non-essential purposes. Essentially, just trying to drive the message home. Take this seriously. If you don't take this seriously, the numbers will continue to rise. And if the numbers continue to rise, this lockdown will have to be extended. Right now, it's supposed to last 2 weeks, but the government has already warned that they may have to extend it beyond that. Hi. So food deliveries, of course, postal deliveries and the like are permitted. If police think that people are traveling for trivial reasons, they'll turn them around and send them home. And also all those people that made the mad dash to go back to their hometowns, they're being told, now you've gone home, you stay there until this lockdown ends. And police with the help of the army, are mounting major roadblocks as well on the highways to try to deter people from traveling. Okay, some more bite? Okay, okay. Oh, will he talk to me? Okay, we'll go see the officer. Apparently he might be willing to talk. And boleh cakap bahasa English? Okay, good. Tuan. Okay. Hi, Rian from China Global TV. Just doing a story, actually a report on the lockdown, and just wanted to ask you, how are you finding in terms of people getting the message now and complying with this lockdown order? How are you finding that it's finally getting through to them? They have to stay home unless it's something urgent.
You mean like what?
Well, the fact they're not traveling unless they really have to. The first couple of days it wasn't so good, right?
Okay.
People were coming out and they had trivial reasons for going out. But with the Prime Minister going on TV saying, just stay at home. You know, with...
So far they were giving reason for important job only. So like bank staff and then for the social, like the cleaning service, like that only.
And you find that the people do have good reasons to travel now? They're not just traveling because they fancy their favorite dish?
No. So far, no.
And what about with the help of the army? How has that allowed you to mount more roadblocks? You have more manpower and be able to...
Getting better. Yeah.
Good. Keep up the good work. Thanks a lot for helping keep us safe. Okay, we'll try to cross the street and let's see if we can listen in on what the police and the army are saying to the people. Okay, carefully. I'll just guide the cameraman here so he doesn't get run over by traffic. Okay? Selamat pagi. So people are explaining to the police of why they're out. If they're going to work, they should have a letter to show from their employer that they have to go to work, that the banking industry, for instance, is still open. Of course, restaurants, as we mentioned. Some factories are open, although not, of course, in the central business district. Restaurants are open too, a lot of restaurants, but they're only open for takeout and delivery service. Okay, so while Simon, the cameraman here, is shooting this roadblock, I'll see if I can find some questions from you. So inspecting a letter from an employer. Well, the first comment I've got here is put the mic closer to the reply so we can hear better. Yes, because of course the police officer was wearing a mask, so his answers were rather muffled. Now someone here says, CGTN, please correct it, not lockdown, don't cause public panic. Now, as I explained at the beginning, perhaps this person hadn't come onto the feed yet, that's William Tan. The official name for this action the government taken is a movement control order, and they asked us not to use the term lockdown. I've been using the term partial lockdown for the most part in my reports, but I do note that media in other countries, such as the UK, where they imposed measures yesterday, and their measures are much less stringent than they are here in Malaysia, the media there are using the term lockdown. So clearly it's not a complete lockdown. It's not a curfew. There's no martial law here. And as I've explained, people are allowed out for essential services. So it's officially called an MCO, or a movement control office order. Some people, one person here, Irene Chong, is saying, I'm not sure it's sufficient enough for the current situation. And clearly some people think that it should be more stringent than it is. Perhaps when they're seeing this number of cars behind me, they're thinking it's not effective. But we have to remember this is a roadblock, so the cars are backing up here. And this is the absolute busiest part of Kuala Lumpur. Okay, I think we'll take a stroll. We'll see if we can see anyone on the street and try to ask them why they're out and about. Clearly this is a delivery van, so they got a legitimate reason. Okay, try to come across, Simon. Okay, Simon. Okay, we got to duck under some ropes here. Okay, we'll go around this way. I already ran into that rope. Here you can see a delivery of rice, and whether that's going to a supermarket. People here in Malaysia, of course, are also doing charitable work as well, donating money, because there's a big worry as well about the impact of this lockdown on low-income people. Okay, I'm going to walk back over to the main street. And yes, as mentioned, many people in the lower income group are petty traders and hawkers, and they will have basically lost their entire income at this stage. So there is need for charity, and the government is also doing its part to try to assist as well. Now, before we head over to try to see if we can speak to anyone. Let's just have a look here at some of the other questions that we're getting. Here's one from Catherine Wong. She says, thanks China for donating millions of face masks and medical supplies. Yesterday, China donated, I believe it was some 10 million face masks. Malaysia does have its own face mask making industry, but normally those materials are exported. But Malaysia has instituted a ban on the export of such products. Here's another one. Julia Teo says, people have three choices. Just stay at home, stay in a hospital bed. And then it says, stay in the photo frame forever. So I think she's just saying this is the life and death situation. People need to follow this order. If they don't follow this order, then this is going to be much, much more serious. Basanta Dahal is asking, what is the death toll right now? I'm watching from Nepal. Well, Malaysia actually had no deaths until just over a week ago this time. And then when we had our first couple of deaths, and the number of deaths have been increasing by only a couple a day. I mean, say only a couple, that's a couple too many, but the number of deaths is now up to 16. But Malaysia did a remarkably good job of minimizing that through intensive screening, testing, contact tracing, and getting people into isolation and getting people on ventilators when required. Now they're planning to up the number of tests dramatically. They think within the next week or two they'll be able to do as many as 16,000 tests a day. So that's a sharp, sharp increase in the number of tests, and they're also ordering more ventilators as well. Looking through again. Yes, again, people saying it's not efficient enough. I think they want more extreme measures to lock the country down. But, you know, people need food. I mean, people need essential supplies. And I think at this stage, if people comply with this order to the best of their ability, as the Director General of Health implored us to do last night on television, that it will bring the number of new cases down dramatically, and that we will be able to go back to life as normal. Maybe not for some time. Okay, so we'll head over into the sun. So my camera will have to make an adjustment here. And we're going to head into the sun and see if we can find out why people are on the street, what they're doing here. Do they really have a compelling reason? From what I can see, most of the people on the street seem to be foreigners, not foreign tourists, but migrant workers perhaps, people working in restaurants, but certainly not tourists. This area, as I say, is the prime tourist hub of Malaysia and would normally be swarming with people. Jerity G. Mark says, help yourself first, stay at home. If you have any symptom, please take advice from the medical team. Now, I think a new national hero has really emerged from this crisis, and that is Malaysia's Director General of Healthcare. He has served under 3 governments. Recently, we had a political crisis where the government changed and the new Minister of Health came in. But during that period of little over a week where there was really no government at all, he carried on and he kept the ministry carrying on functioning at full speed. And he is an extremely calming and reassuring figure who explains the situation in great detail, but very clearly to the public. And in contrast, I have to say that the minister went on TV last week. This is the Minister of Health, the new Minister of Health, went on national TV last week, and he perpetuated this myth that drinking warm water would flush the virus down from people's throats into their stomach, where it would be killed by the stomach acid. And this brought a huge wave of national ridicule against this man. And it has to be said that since that interview, he's not done anything in public. He's not held any press conferences, and he's basically handed over the duties of managing this crisis and certainly being the spokesperson to inform the public about this crisis to the civil servant, the Director General of Health, who has been doing a remarkably good job, and as I say, is seen as something of a national hero, I would say. Now, I don't see anyone to talk to. Here's one person, he's quite clearly a foreign worker, probably from Bangladesh. I'm not sure if he'll talk to me. If I do speak to him, probably have to be in Bahasa. Bye. Orang Bangladesh? No? Dari mana? Oh, Nepali. Apa kerja buat? What? Apa kerja?
Restaurant.
Restaurant worker. Okay, so it must work every day. Mesti kerja. Masih.
Mesti itu worker punya masak sana.
Okay.
Makan punya masak.
Okay. Which restaurant? Somewhere here, Chinese restaurant.
Yeah, Chinese restaurant.
Okay. Okay, go to work, stay safe. Okay? Thank you. Now check up.
What this?
Where are you from?
From Yemen.
From Yemen.
Yemen.
Are you tourist?
No, live here.
Live here.
Yeah.
Okay. And doing what?
What? Perfume. I sell perfume.
Oh, you sell perfume.
Yeah.
But your shop is closed now, right?
Shop? I no have shop. Me no
Oh,
have
shop.
shop.
Oh, okay. And so what are you doing downtown now? You're not supposed to be outside unless something important.
I eat makan.
Oh, buying
I eat a restaurant buy food. Yeah.
Okay. Buying Arab food.
Yeah. Arab food, Arab, anything.
Okay. Okay. Just out to buy food.
Yeah.
Okay. Okay. Thanks for talking to us.
Okay. Thank you.
So, you know, a relatively trivial reason to come out, buying food, you'd have to say, given that you could just call Grab Food, Food Panda, a number of other delivery services and have it delivered to you. But some people insist on going out. They're normally discouraged from walking around. Even going outside to get exercise is officially discouraged as well, because in the first day or two after the lockdown, people swarmed the most popular hiking sites in Kuala Lumpur, and police don't feel that's safe, so they will scold you if they see you out on the street. Looking for more comments here. Speaking to this guy so close, where is your social distancing, says Catherine Wong. True enough, he had a mask on. I should try to keep back a little bit further than that. 1.5 meters is the recommendation. I will take your advice, Catherine. Thank you for that. And I'm trying to think what else that you really need to know right now. There's somebody walking a dog. I'm not sure if the police are going to tell him off for that. Of course, dogs do need exercise. They may be lenient with him as a result. There's a McDonald's there that's open for takeaway delivery, and I think they're going to test the person's temperature before he comes inside. And, you know, life does continue, but if people do not take this lockdown order seriously, then we're going to find that it's going to be extended, undoubtedly going to be extended. We need to see those numbers of new infections sharply drop off. If they do sharply drop off, then I think we'll gradually see a lifting of these restrictions. But if we continue to see a similar number of new cases a day, new clusters emerging, people defying this order and going out in the street for unnecessary reasons and driving their cars for unnecessary reasons, then it surely will be extended. So we need to listen here in Malaysia to what the Prime Minister has said and to what the Director General of Health has said. And unless you're an essential service, just stay at home. I'm Rian Maelzer here in Kuala Lumpur's Central Business District. Thanks for joining me today.